Hello everyone, my name is Luke Elijah. Thank you for watching this video. I'm here at my Foot Doctor clinic and we're here with my very special guest who hails from Ireland, Niall Wafer. Thank you, Niall, for agreeing to come onto my talk show.
Thank you for having me.
Right. Now, could you tell us a little bit about yourself, your background, history, and how you became an osteopath?
Sure. I qualified as an osteopath in 2007 in London. It was always, growing up I was always going to do something medical with people. I was always very interested in the more hands-on approach to people rather than the more rehabilitative aspects of exercise protocol and so on and so forth. And it just naturally just came from there. Osteopathy just seemed to suit me a lot.
Right. How long have you been in this field?
In this field, so I qualified in 2007, so about 8 years, a little over.
Okay. What made you get inspired to become an osteopath? Because it's not something that kids, as a child, you want to become, right? Normally you think about, I want to be a firefighter, an astronaut, a scientist. How do you decide that this is the right path for you?
Well, quite honestly, it was a career guidance teacher who happened to fall down the stairs and injure his neck just before my interview. We done personality tests, aptitude tests, and he nailed me. He said medical with people, and I said yes. And he said, what are you thinking, medicine, physiotherapy? And I just didn't have that lust for medicine at that time, and I was like, no. And I said, and physiotherapy, I'm not into the exercise, sports aspects so much, was what I was thinking at the time. And we just came on this happy little marriage. And after extensive research and even going to London and looking at the colleges, and I was just like, yeah, it seemed like for me.
Right, so serendipity.
Yeah,
right?
meant to be.
Yeah, exactly.
Yeah.
Right. Well, could you tell the audience what exactly is osteopathy? What does it entail?
Right, osteopathy is not very well known in Singapore. Okay, it's because of the British thing that's it's working its way in. Very big in Australia and Europe. In America, osteopaths are fully qualified doctors, surgeons, so on and so forth. So that has to be not thought about. It's a manual medicine, it's a manual therapy, so it's hands-on. A lot of people like to think of it halfway between chiropractic and physiotherapy. But from the patient's perspective, you come in, you get a structural assessment, we use imaging where necessary, diagnostic ultrasounds, MRIs, x-rays if necessary for diagnosis, and then it's just treatment. Hands-on, stretching, nerve mobilization, osteopaths learn different tools as they go on, dry needling, and we all start to overlap as we progress through our career then as well.
Right, so it's a lot of integration of many different disciplines. It's quite a broad subject.
Yes, and it's philosophy behind how to fix a body. That is the core difference between all of these. Physiotherapy, chiropractic, things come from the spine, pressure on nerves affects health and neural health. Physiotherapy is very founded in clinical details, exercise rehab protocols, so on and so forth. Osteopathy is more of it's like an art form. I mean, it's very founded in science, and we always try and base ourselves on empirical evidence, but it's whole body mechanics, incorporating, getting hip motion, helping shoulder motion, knowing when to treat the body, when to release these adhesions, sort of looking for these deeper adhesions within the body to promote better movement throughout the whole system.
Right, you explain it very well, but I think for the majority of people out there, they wouldn't know what's the difference, and they wouldn't be able to decide for themselves when do I see a chiropractor, when do I see an osteopath, when do I see a physiotherapist or craniosacral specialist. So could you tell us how does the normal layperson differentiate, and what should they do to help them make a better informed decision on which specialist to go to?
Okay. Personally, if you have a post-surgical rehabilitation condition or a strength issue, or you're trying to get more performance, physiotherapy all the way. It's fantastic physiotherapists in Singapore. If you have, the thing is, we all deal with pain, and a good physician worth his salt knows when to refer out. You come to me and I go, I know the man for you, you know what I mean? And that is your job as well. We deal with pain anywhere. I mean, personally, we deal with everything from headaches to issues with helping respiratory mechanics and breathing to just physical pain anywhere. In this clinic here though, we've tried to, I'm working out of a podiatry clinic, so this is a friend of mine I've been working with over the last 2 years, and we finally come together because I found that things were getting better quicker for longer using his training, and vice versa hopefully. And we're just starting to just really get excellent results with kids development and just chronic conditions. And when we actually come together, putting our two minds together for hopefully for the benefit of the patient, we're doing quite well.
Right. So what would you say is your personal specialty?
I love chronic things. I like chronic things that have been there a long time, because if something doesn't move in one portion of the body, it then creates other adhesions throughout the body. And then this perpetuate. You always hear, oh, I wish you came in to see me sooner, yeah? Just because this is there. I love unloading that web. Now, sometimes that can create real structural change there, and we need to manage that itself.
Yes.
But I love looking through the body. So I love the old things, but I love getting in there early as well. Babies, kids, developmental. We were actually after just opening they call it a neurosensory gym. It's basically, we're trying to simulate a field and a tree for kids in an urban setting. So we've got cargo nets and zip lines and monkey bars.
Yeah, I saw it.
Yeah.
It just makes you want to just go play now, right? Exactly. It's very inviting. All the knickknacks and gadgets and the ropes. It makes you want to be active and
play.
Be immersed, play for sure.
Yeah. That's for the kids, because I mean, we love the developmental problems. You've got structural leg lengths and so on and so forth, and we deal with that with inserts or with therapy, but ultimately they need to just be strong. So many kids' postures are going, you got these PlayStation postures and all this. So this is just to open up that back line. These are just for the regular kids, and then obviously you've got sort of you've got developmental issues, true neurological issues, some of your palsies and so on and so forth, and they get a little bit more specialist care. But just for a general thing, we're trying to make a field and a tree out there, right?
Yeah,
and it's so important.
It's very unique. I haven't seen it in any other clinics in the world.
Well, we were looking and looking and looking, and eventually, when you just kind of go, because we're looking for the best, we'll do it ourselves. We'll just
awesome,
do it ourselves.
that's beautiful. Right, now can you tell us, I mean, you treat so many different kind of patients, from kids to athletes to working professionals, adults, pregnant people.
Yes.
Right, what kind of patients do you normally like treat and prefer to treat? And what would be your procedure when you're treating them?
Okay,
Yes.
I mean, a personal preference on how to treat. I mean, we treat all.
Yeah.
Personally, I like treating pregnancy. It's great. It's a beautiful process. You try and take the medical out of it. You just get them ready for the day. People are always trying to run a marathon with no training, you know. I like that. But it's back to what I just said as well. I like the chronic old things, and that can be in athletes, that can be in teenagers, that can be in your weekend warriors in your office jobs. I love people who are willing to play ball, to take responsibility to themselves and not just come in and just lie on the table and go fix me. You know what I mean?
Yeah.
It's
a two-way process.
It's a two-way. Well, we've got sports exercise physiologist here, podiatrist here, myself here. We're trying to integrate this. We're trying to throw everything at it, and you still can't always get it right. So we need that person to be fully involved. There's so many facets to health and well-being. So I like someone who's willing to play ball, and
Right. I like what you shared with me earlier about how you like to spend time getting to know and understand your patient in and out fully, right? So that you can be able to treat them at a better, more holistic level.
Sure.
And rather than something more commercial, like trying to see as many patients in a day as possible. You really take your time and form a relationship bond with your patients.
So we take an hour for new patients here, 45 minutes for continuation. If someone's very acute, we may take less. If I feel I need more, I will take more. Yes, so it's very individual to them. This is very important I've come from a small town practice, so farmers and I'm used to just sort of going, oh, my shoulder hurts, and you can just get that thing moving and they feel fine about it. They've got their complexes. Irish are by no means perfect, trust me. But when I've come to a big city now, I've noticed that there's more stress components, there's more emotional components. From the expat scene, people have left their world and come to a new one, sometimes for the first time ever. And it's all compounds in anybody's problem. It compounds in their pain, certainly. So their attitudes towards pain, anxious people feel more pain. And managing this is all part of it. Even in starting the condition or when they have a physical condition, the amount of it they feel.
I love your approach. It's very professional. I love, thank you for all that sharing. I think our audience will find it very useful. So what would you say would be some of the upcoming projects that you have in the pipeline for you?
To be honest with you, I'm only working out of this clinic 3 months. And our focus as a group here now is incorporating all these three to maximize benefit for the patient. Yeah, we want to get those kids. You can do so much early on. So the kids' development is quite an important one, and we want to get those as structurally sound as possible. You can do so much. When a kid is slightly off and they're still growing, so much badness can happen with their mechanics. So we can get in there early and we can sort that out. That's going to have the most benefit we can do for people. And then also working with the podiatrist, this is just a new facet to me. My understanding of lower limb mechanics was there, but it is, these people study it professionally for 4 to 5 years. So we're working together there to bring my osteopathy into his understanding of lower limb and vice versa. So we're really just coming together with all our
best of both
backgrounds.
Yes, a combination.
Yeah, to see how we can. So we're building treatment protocols for patients, maximizing benefits, and really taking detailed studies onto, you know, this is what happened with this person, this was what happened with this. So in order to maximize our benefit,
full potential.
Full potential as a group. Yeah.
Well, could you tell us a little bit about the Indonesian collaboration that you have upcoming?
Okay, so I've been working out of Indonesia for the last 2 years. I've been going over there and doing a lot of teaching and stuff like that. Their physiotherapists are fantastic. The level of education is not similar to the rest of the world. So the physiotherapists where I were particular were because they took the initiative and got their books and they didn't get their heads out of them. So they were very enthusiastic to learn. We've been going over there. I've just been offering my 2 cents. Yeah. So I come from a different background, from a different thing. So we've been all coming together. We've been trying to work on scoliosis programs for Jakarta. I've been working in Jakarta specifically. There's a lot of people with not a lot of services for this kind of thing. So we've been coming together and we've been sort of
supporting the community, educating.
Yes. Yes. I'm learning from them as well, of course, right?
Awesome. Right. I love that. Okay. Now, could you tell the audience where can you go to? How can you contact you?
Oh, to contact me, I'm working out of Camden Medical Center. It's number 1 Orchard Boulevard. We're up on floor 7, unit 3. I'm working out of My Foot Doctor. So if you contact us there,
Or you have a website address?
Yeah, you can get us at myfootdoctor.com.sg.
I'll be placing these links below this video, so please feel free to click it. If you have experiencing any kind of pain, right, you know, he's the guy to go to. Thank you now again for your time and for agreeing to be on my video. We hope to see you again in one of my future videos.
Thank you very much.
And we wish you the very best and all the success in your career.
Fantastic.
Right,
thank you so much.
Thank you guys for watching this video. Please feel free to subscribe to my video channel for more awesome videos. Thank you.